Hey Oscar, how's it going?
Hi, it's going good. How are you?
Good, good. So I understand you're getting discharged, so I just wanted to go over a couple of your medications with you. Do you mind if I confirm a date of birth with you?
Yeah, it's June 15th, 93.
Okay, cool, thank you. So let me go ahead and go over, I'll just start on your list of medications. So the first medication is going to be lisinopril.
Okay.
This is a medication for your blood pressure. You've already been taking. All we did was just increase the dose of this medication just to try to manage your blood pressure a little better. Has been taking this medication been okay so far?
Yeah.
Any
no,
issues, any questions for me?
No side effects.
No side effects?
Yeah,
Okay, good, good, definitely. So I'll go ahead and go over at the end of all of our drug counseling now. I'll give you some specific side effects to look out for and specific medications to link them to. So the next medication that we're going to go ahead and discharge you with is going to be atenolol. It's going to be atenolol 25 milligrams. You're going to be taking one tablet by mouth just daily. And this is again another medication to help you manage your blood pressure. It's what we call a beta blocker and works to start to slow down your heart so we can kind of manage that blood pressure and avoid like those elevated numbers. So one side effect, like I was saying, look out with this medication. Can when you stand up, you can get like lightheaded and dizzy really easy. This medication works to lower your blood pressure, and part of the blood pressure is getting blood back up to your brain. So just something to be aware of. It might, kind of slow you down a little bit. You might feel like some fatigue or some dizziness occasionally. Obviously go ahead and let me know or let your doctor know so we can continue to kind of improve upon your treatment. And then the next medication we have for you is hydrochlorothiazide, 25 milligram. You're going to be taking one tablet by mouth just once daily. And again, this is another medication to help control the blood pressure. It's what we call a diuretic. It just kind of helps you to get rid of some of that excess water, and that helps to lower the blood pressure. So these three medications you're just going to be taking once a day. You can go ahead and take them in the morning with or without food. Whatever's easiest for you. The most important thing is that you remember that you are taking them every single day. That's what's going to help control that blood pressure for you.
Okay. So all three of these were for blood pressure, right?
For your blood pressure,
and
that is
then
correct.
They're all taken once a day.
Taken once a day. Yeah, definitely. So those ones for your blood pressure, and then I understand you've been having like some issues with some GERD and some acid reflux.
Really bad.
Yeah, so we try to help you out on that. We're going to discharge you with the medication called Protonix. It's going to be a 40 milligram capsule. You're going to take one by mouth twice a day. So you can go ahead and take this. If you can, best case scenario, you can take it like 30 minutes before you eat in the morning and night. So like breakfast and dinner. Most important thing though really is that you're just taking it twice a day. It's going to start to reduce some of the acid in your stomach. Hopefully you should see some symptomatic relief. Might take a couple days, and that's okay, that's normal. If it gets any worse though, obviously, let me or your doctor know. Okay. All right, and so then next medication we have for you is going to be Lipitor. It's a generic for atorvastatin. It's a 40 milligram tablet. You're going to be taking one by mouth just once daily. This medication is what we call like a statin. It's to help lower your cholesterol. This medication, again, like the lisinopril, is one that you've already been taking. We just increased the dose. Any questions or any concerns with the medication so far, given that you've been taking it for a while?
What are some of the side effects I should look out for?
The side effects, yeah. So some of the side effects can be like some muscle pain or weakness, especially like in the legs or the extremities. If you like started to bleed or bruise really easily, or if you notice like any like discoloration around your eyes, that could be like a rare, a serious but a pretty rare side effect of the drug.
I'll look out for that.
Definitely, yeah. And then just a point for you to remember, if you can, all of your medications obviously don't interact well with alcohol, but especially this one, if you can avoid alcohol and grapefruit, those actually work to lower the efficacy of the medication. We want to, put you in a good spot and be able to protect you. So definitely. So last one. So I understand you've been having just like a little bit of some like muscle aches and pains, like some back pain. Yeah. So we can go ahead and start. We'll go ahead and start with a lidocaine patch for you. It's a 5% patch. You're just going to apply the patch once daily. obviously it's gonna go like on that local area, so if it's that low
Yeah,
back,
lower.
you can go there. You'll see like taking it out of the packet, you know, try to avoid like cutting the medication. You know, once you peel it, obviously apply it to your skin, you know, and then go change it the next day. Yeah, any questions with that? No? Okay.
Yeah,
that
thank
one?
you.
Cool, yeah. So I'm gonna have you go ahead and just repeat back a little bit of like the medications I gave you. So we had the 3 ones for your blood pressure.
Yeah, those are taken once a day.
Just once a day.
And then I have the Protonics. I'm taking that 2 times a day.
Yeah.
Before meal.
Yeah, and before meal if you can get it.
The statin for my cholesterol is taken once a day.
Taken once a day, yeah. And so that one, you know, not a huge deal, but if you can take it at night, there's some evidence that the medication starts to work a little better.
Okay. Yeah.
But again, most important that you're just taking it every day.
Yeah, I'll take it at night. I want to make sure it works. And then the lidocaine patch, I apply it for a day, and then I shouldn't cut it. And then I just apply it to the area that.
Yeah, just that topical area. And you might notice like some local irritation or some stinging. It's like very uncommon, but you know, can happen with the medication. Just make sure also that you know, you wash your hands after you apply it. You know, we want the active medication to be on like the patch in your back. You know, to avoid, you know, putting it in your eyes. You know, try to keep it away from children as well, if you can. So. Cool, so I got all those for you. So what we're gonna do is we're gonna try to have you follow up with your doctor in a full month from now. Gonna go ahead and check your blood pressure, you know, we'll do a lipid panel, also some other labs, just to kind of make sure that these medications are doing what we intend, and that you're continuing to remain healthy. Okay?
Thank you so much for your time.
Yeah, definitely. Do you have any other questions for me?
I'm good, thank you.
All right, appreciate it, thank you.
Thanks.